Hi, Matthew Holt with the Healthcare Blog, another THCB spotlight here. I'm with Tamir Gottfried. He is the Chief Commercial Officer and Chief Strategy Officer at Tyto Care. Tyto has been for quite a while now a pioneer in, I would call, remote patient device monitoring. I don't know how you want to call it to me, but I remember having someone with Tyto at a health developer conference back in Europe in 2016, 2017. So the company's been around a while, and it's in a little area which I think is underdeveloped. But Tamir, welcome. For those who haven't run into Tyto, really quickly, what do you? I've told you what I think you do, but you tell me what you actually do.
Thank you, Matthew. So, yeah, what Tyto does is we basically replicate the inpatient experience in a remote setting, meaning we try to mimic what the physician can do while you're in their office, but allowing him or them, he or she, to have those capabilities in a virtual setting. Yeah. So, for example, under your traditional telehealth visit, under the audio video telehealth visit, the physician can only look at your face, listen to your voice, ask you questions and interact with you that way. And if you have maybe a pink eye, then they can say, oh yeah, I see a pink eye. But if you're coughing or you're running a fever, there's very limited options for that physician to diagnose. Yeah. And that's exactly where Tyto comes in. So we're trying to mimic that experience and take the physical into the digital with our medical device.
So you have the device, and the device has we'll see it in a second. The device has a bunch of things that go with it, but you also have a telehealth infrastructure around the device. So could you briefly describe how those two things work together?
Sure. So the device itself, it's a modular it's a modular kit which comes with the base unit. As you can see, I'm holding it in my hand here with the different capabilities on it. So obviously, high definition camera, thermometer on it. We can show it in a minute. Different types of attachment goes. So for example, the stethoscope. So the physician can listen to a person's lungs, heart, bowels, etc. An otoscope, again, blue dot to blue dot, where a physician can look inside a patient's ear and be able to see if there is any issues there. There's a tongue depressor, and there are other capabilities that connect into this device, allowing to get SpO2 readings, blood pressure readings, and more. Yeah, but this is basically small device, handheld device, modular.
So let's see if it works. Are you alive? Let's take your temperature.
Yeah. Let's do the temperature exam. So it's guiding me. So there's a lot of AI components into this, because for the lame person on how to do some medical exams, we have some things,
so it guides them on the screen.
Yeah, it guides them on the screen, and it's telling me to position the device a couple of inches from my forehead.
Okay.
And there we go. There's my temperature.
Oh, look, you're alive. Well done.
Yeah.
You're a little bit cold, but let's turn the heating up.
Yeah, the air conditioning is too strong here. But likewise, when you're doing, for example, for the otoscope, right? The otoscope. So if you want to look inside of the patient's ears, again, you can collect the information. It guides you on how to, place the device, how to capture the right image. And over the years, we developed a lot of capabilities that enable us to really capture the right image, and the technology validates whether that image not only is it good enough, but is there an issue with what was captured. And these are things that again, with the data that we've been collecting over the years, and to date we have over 9 million exams, we're able to now run our algorithms and really AI on it to diagnose conditions.
So I'd love to get into that, but let's first, you've got a little video you're going to show here of how it works from the perspective of the clinician at the other end. Now, I understand this is both, you can do asynchronous stuff and synchronous use. Is that true?
Correct. So most physicians today prefer for this to be asynchronous, right? So while you're waiting for the physician to get online, Tyto uses our a symptom checker, basically to guide you through which type of exams will the doctor need to see.
Yeah.
Then while you're in the waiting room, you basically do your own examination. So when the physician comes on, they can already see the images, hear the sounds, look at the videos, and be able to diagnose while they're speaking with you, instead of you having to fiddle with the device while the physician's online. Now, in case a physician does want to hear something again, it will go into synchronous mode where they can actually control the device remotely and then continue the further examinations if needed.
So I think you've got a video of that. So why don't you pop that up?
Yeah, I mean,
it'll give us an idea about what the clinician view into this is if they're doing synchronously.
Yep. Oh, can you see my screen?
Not yet.
Not yet.
I hear the little funky. I don't know who wrote the little background music for all these sort of 2-minute videos, but they must be very rich by now.
Probably.
They all use the same one. Although the guy who wrote the Cisco hold music, which is on every call center in the world, his roommate stole it from him and he never got paid, even though it's been listened to. There's a whole NPR example about waiting on hold for that. Okay, we're seeing it now. So when you play it. This guy looks far too healthy to be a patient.
Hi, John. I'm Dr. Williams.
Hi, doctor.
So right now
I
you're seeing the
understand you're not
physician.
feeling well.
Okay, so this is the physician.
I've been weak for a couple of days now. Can't sleep, have fever, and coughing at night.
The patient's getting the instructions
let's
as
conduct a few
you from
exams
the
now,
device.
starting with your temperature.
Correct. And they're now in
Please
synchronous
place
mode.
Tyto a few inches from your forehead.
So he needs much help figuring out where his forehead is. This guy's not doing as well as
Great.
you were.
Let's listen to your lungs now. Please attach the stethoscope adapter.
Okay, I think you showed us that. She puts on her headphones.
Place Tyto on your chest and breathe. Please move it right now. Great. Breathe again. Perfect. Let's take a quick look at your ears now. Please attach the otoscope adapter.
Well, I don't know. Maybe the guy cleaned his ears before. Half these ear
the
exams are completely disgusting. That was not so bad, actually.
Great.
Mind, there's
now
tons of
replace
wax.
the adapter with the tongue depressor. Open your mouth and say, ah.
Wow, this guy has very nice teeth. He's clearly not
Excellent.
British.
We're all done with the exams. You did great. So based on these exams, I was able to see that you have some.
All right, I get it. So that's great. So, I mean, sped up a bit. Obviously, that's mostly done asynchronously before. And this is kind of like the missing link for telehealth that I've always thought about. So let's talk about a couple of things. Let's start with the thing you mentioned, which is the sort of algorithmic interpretation of what's going on here. What in a typical asynchronous piece, and I think can you explain a little bit how there are? I think you have other devices that connect as well, blood pressure cuffs and SpO2 meters and stuff like that. Can you explain a little bit more about how they all connect, and then what the process of getting a full asynchronous exam is to the doctor when they're waiting, and then sort of what happens? What's the typical process they're going to walk through?
Yeah, so let's take you through the journey of using Tyto. Let's start with the device, the components that you can connect. So not everybody in their house needs a blood pressure cuff, for example, or a spirometry, right? But there are some patients, maybe with chronic conditions, maybe there's a family with an asthmatic kid that they do need these additional attachments or equipment that connects with Tyto. And now these equipments are fully integrated into Tyto. We use they're fully integrated into Tyto, and while you're going through the examination or when you're actually logging into the app to see the physician, you're going through the workflows, clicking that you want to see a physician. The technology will ask you, what is the visit about? You will start communicating with the device saying, well, I'm not feeling well, I'm coughing, I'm running a fever, and you'll go through a screening that our AI or the wizard kind of walks you through. Yeah. At the end of that, the device will tell you, okay, while you wait for a physician, because you'll be put into a digital waiting room, let's start taking the exams, right? And then it will guide you if you need to take an analysis of your lung sounds, then it will guide you to connect the stethoscope, as we've seen in there, and then we'll say place it on the right side, left side, etc., and get the recording. Now, what's really interesting is over the years, again, as I mentioned earlier, we collected a lot of data and they run our analysis on it, run our algorithms on it to a point where we can now, and this is FDA cleared, run our lung sound analyzer and already detect if there is something there. So, for example, we already have 3 FDA clearances for wheeze detection, crackles, and rhonchi in the lungs, therefore covering pretty much the lung conditions. So if something does pop up, we can already flag it for the physician. So when they do get that visit through, they'll start looking at their notes and seeing the recordings, listening to the recordings. And if there was something detected, the system will flag it for the physician so that now they don't need to listen to the full maybe 30-second recording to identify the issue. So that is the general process or flow for a patient when they grab the technology, they connect through their app, connect to their physicians and so forth. Now, at the same time, we're also integrated into the EMR, the hospital's EMRs. And so we're able to not only capture the information, but also keep those recording available for future use for those clinicians.
So that's great. You've got the device, obviously, all the attachments, the platform, the telehealth platform, which is presumably most people use it on an app on their phone or the computer. I guess either way.
That's an app on the phone, right?
Yeah. And then and the clinician sitting there on their computer and doing standard telehealth other end visit. And then you've got all this sort of pre-diagnostic work. One more thing, do you guys also supply or contract with your own telehealth medical group, or you only sell the product line solution to third parties?
Yeah, so we are neutral. We, by default, we do not have our own medical provider, so we're always going to come to with some medical providers. So when we do sell, obviously through the payers or to employers, we will have our preferred partner or the partner that they use integrating to the platform and work with the big telehealth providers. Or when we work with health systems, we basically use their own physician.
Yeah. So, I mean, so you're clearly a technology vendor here, not trying to do not trying to do the full service part. But this raises to me a sort of very interesting point right now, because you're providing a couple of things. So one is obviously the connectivity around the ability to extend that telehealth visit. But the second, which is all this data around and tracking people with chronic illness. So how much, and I don't know how far you've gone down this path, how much of the interaction between TytoCare and the physician, payer, clinician group, whoever is the sort of end user of the data, how much of that is just asynchronous people checking in, and how much of it is actually in the context of a visit? So let's say I have a chronic condition or whatever, and I want to, and I want to be taking my blood pressure measurements or my SpO2 or my, checking my wheezes or my pulse or whatever it happens to be, and it's not like an emergency thing where I have a high temperature and need a prescription that day, but I have, hypertension or whatever the issue is. How much of this is this being used as a tracking device by consumers that a clinician will check in occasionally, and manage sort of over time rather than a sort of urgent event?
Yeah. So it's a great question. It's a great question because earlier this year or late last year, we released our chronic care management module. Right. Until then, it was mostly urgent care visits. If something goes wrong, then you connect and you see your physician. Though some of our customers, and we work with over 250 organizations, health organizations globally, but some of our customers actually also deployed in the primary care setting. So if you want a regular primary care visit, you can schedule that with your physician and then use TytoCare for that. But as I mentioned earlier, we released the chronic care management module, and now there's a new version of it coming out, which is the Smart Clinic Companion. And that really is focused on the individuals at home that have chronic conditions or some sort of a conditions, whether it's hypertension, asthma, CHF, or whatnot, to use the app for different things. So number one, it's to track symptoms, right? Or track their conditions over time, get a baseline, and then if there's any anomalies, it will be flagged and alerted. Help them guide through their, their day-to-day life. So it's whether it's medication reminders or journals that we have on the applications, but all the way to a point where if you do have something going on, if you wake up one day and you're not feeling well, maybe you're asthmatic and you start coughing, or you're a COPD patient and you start coughing heavily, instead of picking up the phone and calling your physician immediately or rushing to the ER, the point is to first go through the app, go through Tyto, and then Tyto will let you know whether it's something that you need to consult the medical professional, or is it something that you can continue managing on your own? And this is the degree that we got to. And as I mentioned earlier, that's where our AI comes into effect, and where the FDA already cleared some of these functionalities, and there are more in the pipeline. So,
yeah, I think that's the sort of very interesting part. So I'm going to go ask you two questions. The first one's about the consumer aspect of this. So I'm correct to say you don't sell this directly to consumers. This comes via payers, health plans, or others, right? So they're distributing these devices. Why? So you don't do this. Why do you think that? Why is this not a consumer device? I don't know how much the thing costs, but my assumption would be that if I am a worried mum of kids and I want to check their ears and their temperature and whatever, and I want to be able to connect this to a telehealth doctor, this strikes me as an obvious consumer product that you should be able to sell to millions of people. So why have you not gone down that path?
Yeah. It's something that we envision. We envision every household to own a Tyto device, and that will be their go-to when something goes wrong in the household. But
and to interrupt you, by the way, people have tried this, right? The company have tried this with the smart thermometer and some other things.
Right.
It hasn't done. So maybe I'm wrong. It hasn't done that well, but it does look like a very obvious thing everyone should have.
Correct. So there's a big factor here that is going on. First of all, it's a behavioral change for consumers, right? You're not used to consume real medical examinations in a virtual setting, and obviously COVID taught us all that yes, you can do a telehealth visit, but there's a trust factor in there where you want to know that there's actually a physician on the other side that can really diagnose your condition. So to go into a retail location, pick up a device, and then connect it, the question becomes, who do you connect it to, and do you trust that physician on the other line? So with that in mind, we decided the best strategy is to go with either your payers or your providers. And then when you're actually using the technology, or you have something, the first thing that comes to mind, it's that hospital system or that provider group or that payer that you work with and that you trust. And that's what they remember. That's what they go to first, right? So if you're looking from that angle, and obviously the scalability, the ability to reach a wider community is far greater. So again, it's a behavioral change that we need to overcome, and eventually it will be there in a point where people will just go and seek those devices. Now we do have customers that do sell a direct to consumer, right? Or health plans that do provide this to their consumers, and we see that the impact that it's creating is vast. Not only in the cost saving for these organizations, right? For example, in payers, but also in the convenience and how patients enjoy the technology. And today, we run an NPS survey after every exam, and we see that we have 83 points in NPS score, right, on that. We see that there's a 98% resolution rate during those audio video visits, right? We see that the utilization of this technology is 5 times greater than that of audio video. So again, there are a lot of factors in there that show that this actually is a preferred way of getting care over regular traditional audio video, or driving all the way to your urgent care facility, sitting in line, standing around sick people, right? And then to see a physician for something that could have been diagnosed remotely.
Yeah, I mean that all makes a lot of sense, and I understand the strategy there. And so if I am I know your typical arrangement with a health plan or provider, how do they decide who of their patients gets, their members' patients gets this? How when you have an agreement with them, and they say, great, we're going to, use TytoCare for our population. Which subsegment do they go after? How do they explain to you, okay, we need to, we need you to deliver, or maybe they deliver. Somebody somewhere has to deliver a bunch of these out to somebody. How does that all happen?
Right. So it varies from market to market, right? Different geographies. Today, we're operating in over 25 countries. But in the US, which is our largest market, unfortunately, it's still a fee-for-service health system, right?
Yeah.
Where if you're with a health plan, the health plan will select the right individuals that would benefit most from this technology, the right individuals that essentially cost them the most. When we're going through health systems, then they're looking for the cohorts or the population that they're taking risk on, especially the ones that they're fully capitated on. For instance, if an organization has a full capitation on a Medicaid population, then they would go and offer them Tyto first in that respect. Also in the US, we work with employers. Yeah, and some of these employers are obviously on the risk for their employees. So they will go and offer it to their employees with a way of encouraging them to consume services in a virtual setting, which are much more economical for them than them actually going and going to urgent care or emergency department, which are the costlier options.
So when you have that situation where you are selling essentially through a partner, or you are being fulfilled through a partner, now that we can discuss how they're paying for it in a second. Yeah. A lot of people have that issue, especially going to an employer, going to a health plan, and they sign a contract and sign a partnership. All sounds great, and then somewhere lost in the details. People don't know how to figure out how to get through it. It doesn't have, it's a problem. How do you ensure that this thing actually gets used by the people who are using it? How does it actually get fulfilled, get used, get plugged in, so that they're actually getting value out of it?
Yeah. So over time, we developed our Bibles, and we have a great partner marketing team that work closely with our partners to develop those journeys for them. And that goes all the way from how do you provide awareness campaigns to those individuals to know that, yes, there is an option or they qualify for an option to get the Tyto device. And then it leads them all the way through the decision process, the buying process of saying, yes, I want to whether buy it or I can opt in and get a free device. And from there, we developed Amazon-like fulfillment capabilities. So TytoCare actually does all the fulfillment and engagement with those patients. So we actually send the device out to the patient. We track it from the moment it left our warehouse to the moment the patient received it. And then we know exactly if after, I think it's 48 hours is the golden rule, that they haven't unboxed the device, then we will start encouraging them, whether it's through text messages, emails, or sometimes even phone calls, encourage them to open and help them go through the settings. Now, there are a lot of obviously wizards that take them through that, but some in the elderly or others that are less tech savvy will require more hand-holding, and then our team is there to support them through that as well. But the key is to get them to try the device, whether it's on their own or through playing doctor with a virtual physician, but get them comfortable enough so when they do need to use it, they don't have to try and figure it out, right? So again, we develop this muscle internally, and we provide these Bibles to our customers and ways of working with our technology.
And do you have any data on usage rates and the amount of times the individual device gets used by a family or household? Do you have some suggested stats about that?
Yeah, so we see today in a population, usually it's measured by a population of 1,000. So we see in a population of 1,000, we get about 45% utilization, or north of 45% utilization under certain cohorts. We've seen cohorts that also reach over 75% utilization of the technology. And again, it really depends on who are you targeting and so forth. And a lot of times what will happen when we work with payers, for example, they will look at claims data. And again, we help them with their actuaries. We'll help them figure out the right numbers. And we will target together with them the individuals that might be the frequent flyers to the EDs, right?
I assume a lot of this is kids with asthma, and so there's a big category, I would think.
Yeah, children, families with young children. But we've also seen something very interesting. And this came out from a study that we've done with one of the largest payers, a tier 1 payer in the US. They've done a study and they've seen that initially they were targeting the kiddos, right? Families with young children, and we saw a nice utilization from the children. But then what surprised all of us is we also start seeing adults use it more and more. The parents actually use it because they figured, if this is working with my kid, now I can see a physician. And as you know, if we have a little fever or we're coughing, we're just going to ignore it and, go on our day or take a sick day and stay at home and relax. But here suddenly it allowed the parents to say, well, hold on, I can get seen as well without needing to take the day off of work, without needing to go to my physician. So we've seen an interesting peak there. And if I remember correctly, it's around 46% of the users were actually adults on this technology, adults in the range of 35 to 45, right? So again, very interesting stats that came out of there.
Interesting. Let's talk a little bit about your business. How when you have an arrangement with a payer or with a provider, how do you guys get paid? And I want to preface this by saying, obviously, TytoCare has raised a decent amount of money, most of it since the pandemic, and also most of it, I don't know if this is connected, since the RPM code payments started coming in. I don't know if you have managed to figure out a way to get paid via that. How do payers in America think about it? And then, while you're talking about the other countries, how do your customers in the rest of the world pay for you? But what's the basic business strategy that you're employing here?
Yeah, so initially we launched more on a subscription base, right? So we would sell B2B, and they would either sell or provide it to their customers. We had that going on for quite some time, where they would be on an annual subscription of our technology, with certain commitment and so forth. But what we actually started rolling out earlier this year is more of kind of a risk-based approach, where we're taking some of that risk from our customers. And the reason for that is we've seen exactly how effective our technology is. We've seen the high utilization rates, where we're feeling comfortable to start charging per engaged member, right? So now, rather than charging for a device that sits in a household, maybe with 4 or 5 individuals in that household, now we shifted over to a model where our customers will only pay when the technology is used. And that shows the level of confidence that we have in our solution. And also it gives confidence to a lot of our partners, because essentially they don't get paid or they don't get any savings unless the technology is actually used, unless they get to avoid that ED visit. And here Tyto is coming forward and saying, you know what, we're with you. If we can avoid that ED visit, then you need to pay up.
I see. And then how does that work in the rest of the world?
In the rest of the world, it's quite interesting. So, for example, there are some countries, we work with some HMOs in some countries. They're regulated a bit differently. So they will fund part of the device. They will sponsor part of the device, but then they actually have to sell it to the consumers. So they will run campaigns and they will sell it for relatively a low price. But then they will keep on paying the subscriptions to TytoCare on the back end. So it's a bit of a different model than in the US. But what also we've seen in some countries, because again of the health systems there, the payers are really the ones to launch the home programs. We have a big presence, for example, with AXA. Mainly in Turkey is one of the markets that we're deployed, and we're deploying other markets as well. And again, they're offering it for certain plans that they're running. But interesting enough, we're talking a lot about the home side of TytoCare, but we have the same technology that is used also for remote settings, right? So for the maybe rural clinics or schools, we have over 2,500 schools using our technology. In fact, we have over 8,000 micro clinics using our technology. And these are facilities that they might have limited resources, limited capabilities. And as you know, this is a growing problem across the world with the shortage of physicians and access to care in general, where some of these health systems, again, in the US and abroad, they're deploying TytoCare in these different access points, not only to provide access to primary care, but also to specialty care, right? So even we have a customer in South Dakota, that deployed TytoCare in over 300 remote locations, with the point of allowing cardiologists and pulmonologists to have access to their patients that might sit 3 to 5 hours away from their facilities, right? So now they're expanding their reach and providing better care into the communities.
Yeah, and I got to say, I'm one of the things I've got totally wrong about how healthcare is going to be changed since the early days when Tyto Care was starting out, but other companies like Amwell and Teladoc were doing the visits. Was that I've having experienced this back in 2012 and 10, I just am shocked that there hasn't been more uptake. I know there is uptake of telehealth, obviously the pandemic changed it a bit, but it just shocks me how little these technologies have been used overall, given the stress we have and how effective they can be. But
so it's
that's commentary. That's let me ask you why you guys haven't done that well.
Yeah, no, but it's interesting. So again, it's the behavioral change, but it's also the Amwells and Teladocs in the world, which by the way, both of them are partners of Tyto Care, and now they're deploying Tyto Care to their customers, right? But it took them time to understand that audio video can only take them so far. And audio video is a commodity today. Everybody does it. And the quality, the care that is provided through there is limited to what they can do. They're limited in a lot of ways. And so here is where finally they got the idea and they understood that Tyto Care can really distinguish them and can really elevate the level of care that they can provide.
So let me close with two questions about the future. One's very pedantic and business-like, and the other one is much more sort of futuristic. So you guys raised it, been around, I think it was 2012 was the original start of the company, something like that. It's been a while, right?
Yeah.
A number of digital health companies have now finally made it and gone public, but that was around in 2020. You raised a lot of money, I think over $200 million during the course of the pandemic, but it's been a while since you've had a raise. And I think there was a quote from your CEO saying during the last raise, this is the last time we're going to raise money, something like that. So how's the company doing? And when can we expect to see, those poor investors who've been sitting around since the early 2012s getting some of their money?
So we've been around since around 2012, about 13 years, though the early years, it was a lot of development and going through FDA regulations and so forth. So commercializing, I think we've been commercializing for about 7 years now, give or take. Over the years we raised I think we're at Series D now with around $200 million in total funds raised. And every CEO that you ask during a fundraise, they'll tell you, "Oh, this is the last time I'm raising funds." But in essence, we're building we're building an IPO company, right? We're building a company that's going to keep on growing and scaling. And there's going to be different steps that you take along the way, whether it's another raise, whether it's an M&A, a lot of things can happen along the way. But obviously, we have great investors that support us and understand the mission, understand what we're doing, and they're here for the long run. So yeah.
And what would you say the level? I don't know if you have disclosed revenue numbers or partnership numbers. What would you say the level of penetration of the potential market is so far? I mean, I would say low, I'm assuming, but given no one's offered me one.
I think the penetration is still there. There's a lot more to go, right? I think we're just starting to scratch the surface. Once we start seeing, payers offer it across the board to all their members, it's going to take some more time. Payers, health systems, the health industry in general is really slow to move. And they adopt to new things like that. So it's going to take some time, but we have been growing year over year in a healthy way. Our customers are sticking with Tyto Care. They enjoy Tyto Care and they grow with us, and they'll continue to do so. And as they do, we'll get a bigger and bigger market share. I can tell you for sure today, there were some Tyto competitors that came about, and it's it takes time. You need to sustain the company for a while to start going through that behavioral change. And some of these competitors couldn't get the regulations, couldn't get the clinical buy-in, which is a big part of it. In order to be successful in the clinical world, you need a clinical buy-in, and that takes time. So once we have all these health organizations really vouch for Tyto Care and the key industry figures speak highly of Tyto Care, it's very difficult for other competitors to come in and penetrate the market. So we're continuing to dominate the market. We encourage competition because we think at the end of the day, we shouldn't be the only ones educating the market on the capabilities of these types of technologies. But today, we're the only ones that really provide a holistic solution, kind of an all-in-one for primary care. And there are a lot of competitors out there doing very specific things to what you mentioned earlier, a digital thermometer, a digital stethoscope. But really, we're the only ones that provide an all-in-one kit that is FDA approved. And another thing that you see, there are a lot of lifestyle companies out there providing technologies just for people to use at their home and play with it, but they're not necessarily clinical grade to a point where you can have a physician trust that they're getting an accurate image or sound and so forth. So here's again where TytoCare shines and why we're trying to do it the right way and not rush to get something in there that's going to eventually land as a lifestyle device.
Yeah, I think that's super interesting. We're seeing the growth of like the Aura Ring and even Apple trying to put the
by the way, those are all great. Those are all great. And the vision, so you talked about the vision that we have. We're investing a lot in AI. And today, we have the largest repository of unstructured clinical data. We have over 9 million exams on our platform. And we're using these exams with actually physicians to build our AI capabilities and get to a level that is on par with a general practitioner, or in fact, sometimes superior to a general practitioner and on par with specialists analysis, right? So we're building it in that way, and the keys that we're seeing, an integrated household where if you have your rings or your watches, but eventually have all that integrated through TytoCare, where we're going to be able to look and continuously monitor what's going on with your condition, run it through our algorithms, and then be able to guide you through what's needed, what do you need to get done in order to get better care.
So you kind of preempted my last question, but what do you think this looks like, assuming it's more generalized and more people are being monitored at more times, sort of consistently rather than just during a physician's visit? What do you think TytoCare or this type of sort of remote monitoring care at home looks like in, say, 5-10 years?
We're expecting it to provide more capabilities in the individual's hands, right? So allowing more individuals to manage their own conditions remotely. So, as I mentioned earlier, we're now scratching the surface with AI capabilities, but you're basically, and we're going to release that very soon, the Smart Clinic Companion, which allows you to really monitor your condition, manage your condition at home, then come to TytoCare when maybe just a baseline or when something goes wrong, and then TytoCare, through the analysis, guide you on whether you really need to go see a physician or we should continue monitoring your condition, maybe get tested in a few more hours to see how you're doing, or just tell you, listen, just sleep it off, you're doing well. So that's where we're going, a connected home where Tyto is going to be at the center of it and guiding you through your conditions.
Yeah, and I think that's a very obvious vision of the future, and I sincerely hope we get there, because as you mentioned, we don't have the manpower, we don't have the idea, and we still have a sort of a point-based stochastic system rather than a continuous monitoring of care. And I think that's something that as we deal with more and more chronic care and chronic illness, we're going to have to figure out how to manage that better. And obviously AI plus sensible guidelines for people before they have to call on a professional, when we have months and months of appointment. I was talking to some guy the other day who said he couldn't get an appointment with his doctor at Stanford for 9 weeks. Something. We can't go on like that. So
100%, and that's the exact problem that we have today. It's a shortage of physicians. I think they're saying that by 2036 there's going to be a shortage of about 40,000 PCPs, right? So
yeah,
it's a serious problem, and also hospitals, they can't keep on building facilities. So they're trying to move a lot of that care to the home where it's less costly, more convenient for the patients. So more of these services are going to move to the houses, but now you need to have the technology there that allows these capabilities. Because what's happening now in a lot of these home hospital programs, they end up sending a nurse to visit. They end up sending somebody to visit the patient and take those readings. Where we see that's going to be the next area that is going to need to get resolved.
Fantastic. Well, certainly a lot to be done there. I've been talking with Tamir Gottfried. He's the Chief Commercial Officer and Head of Strategy at TytoCare. Tamir, thanks for your time. Great to catch up.
Matthew, thank you so much. It was great.